Good morning, everyone. Morning. Welcome and thank you for joining us today at Downstate for our conversation with Pat Wang, who is CEO of Healthfirst. Today she is going to be talking to Dr. Gwen, who is our Executive Vice President, and we are here to welcome Ms. Wang. I think I said that wrong initially, my apologies. And I said this to myself, Ms. Wang. Who will be sharing some of her journey with us and what it is that she's learned and share some experiences and life lessons for us to understand. Thank you all. Before I forget, may I ask that you put your phones on vibrate, please, so that we don't have any challenges along the way. Thank you. I'll now turn it over to Dr. Gwen.
Good morning. I hope my mic is on. I think I hear myself. Pat Wang joined Healthfirst as the president and CEO in 2008. Since that time, the membership of Medicaid and Medicare Advantage customers have grown significantly, as have its quality rankings. Today, the company enrolls about 1/3 of New York City's Medicaid population and a significant percentage of people eligible for both Medicaid and Medicare. It is one of the largest not-for-profit health insurance plans in the country. So we are welcoming Pat Wang here today in recognition of AAPI, which stands for, and most of us already know that, Asian American Pacific Islanders Heritage Month. So we are extremely excited. I'll finish her bio. Pat is particularly interested in healthcare policy, notably how it can support equity for all communities. She served as a commissioner for the Medicare Payment Advisory Commission, also known as MedPAC, from 2016 through 2022, along with our own Dr. Riley, here, President Riley, who couldn't be with us today, by the way. He is serving as a commencement speaker at another one of our SUNY institutions, SUNY Optometry in the city. Let's see, she is a member of Governor Hochul's Stakeholder Committee advising on New York's first master plan on aging, and served as a member of Medicaid Redesign Team 2, as well as a co-chair of the state's Vaccine Equality Task Force. Pat was appointed as a director of the New York Federal Reserve Bank. So she is on the reserve, on the Federal Reserve. I don't know what that means in terms of us having left a check for us, but we'll talk about that later. Let's see, she has been recognized by local and national publications like Modern Healthcare as one of the top females on diversity leadership in healthcare, which is a great honor. Before joining Healthfirst, Pat was part of the executive leadership team at the Greater New York Hospital Association, where she helped create Healthfirst in 1993. She is a graduate of Princeton University. We have some other Princeton folk here, as well as NYU Law School, cum laude. So she is a lawyer, so I'll be careful what I say to her and what I don't say to her. She has lived in Yugoslavia, China, Taiwan, and of course, New York City. So she is a world traveler. So I want to welcome, again, I want us to all give Ms. Wang a round of applause for joining us for AAPI today. And I will start this by simply asking Ms. Wang to tell us who Pat Wang is. Aside from your bio, who is Pat Wang? Tell us who Pat Wang is.
Well, first of all, Dr. Gwynn, thank you so much for inviting me and the SUNY team. It's a great pleasure and honor to be here and spend a little time with you during AAPI month. It's a tremendous celebration, and we work very closely with SUNY at Healthfirst. It's a very important. Dr. Riley is actually the chair of our quality committee, so he's awesome and shares his expertise with us. You don't need to worry about me being a lawyer, because it's been a long time since I practiced, and I would call myself a reformed lawyer. And one of the things that I know very well is the importance of having good legal staff, because if I counted on myself for legal advice, it would be a really big problem at this point. That's just not the role that I have right now. I just in response to your invitation to give the brief bio that's not part of the official bio, I'm the child of immigrants. My parents both came over from China in the late 40s and early 50s, which was, and so I grew up in the 50s and the 60s prior to immigration reform in 1965, which really opened America's doors to, diversity of the world. And increased our immigrant population by so much. So growing up at that time and my parents coming over at that time, I can really see the difference between then and now in terms of the richness that immigrants have brought to the country. My own folks came over at a time when there really weren't very many Chinese people in America, and we were kind of concentrated geographically. So that experience has made a really huge impression on me and really given me firsthand appreciation for the importance of immigrants to America, both our past and our future. I went to public school, had a really nice opportunity to go to a great university, and explored the world a little bit before deciding to go to law school. That set me off in a different direction in my career, and I became interested in healthcare and sort of wended my way. No master plan.
Well, how does one, that's a fascinating sketch. So, but how does one end up with no master plan and end up running a $16 billion company?
Yeah.
How does that happen?
Yeah. It's a really great question, and I think it's something important for everybody to embrace about themselves and their own futures. I think that the one thing that I did through my life that has contributed to where I am now is to take some risks. And to do things that were unknown to me. When I went to law school at the advice of my then husband. I was actually thinking about graduate school. I was very interested in education. I was close to getting a teacher certification. He said, I think you might enjoy law. And I said, I don't even know any lawyers. I don't even know what that looks like. But my brother thought that it was a great idea because he said, you like to argue with people, so it's probably a good profession. But after some exploration, that's the direction I went in. It really, really was completely foreign to me. At the time, I had no idea what to expect, and I just loved it. The opportunity that I had at the Greater New York Hospital Association after I graduated from law school, I had the great privilege of clerking for a federal district court judge in Lower Manhattan, and that was amazing. And I then went to work for a law firm that specialized in healthcare law. And while I was there one day sitting in the partner's office, he got a call from the head of the Hospital Association, which represents SUNY and many, many other hospitals in New York State, who said, they're looking for somebody to run their health economics and finance function. Do you know of anybody? And I thought about it, and I said, I think I might be interested in that. And he said, why would you be interested in that? And I said, because I've gotten involved in healthcare policy. I really love reimbursement and the effects of, it's like tax. It's, you set certain financial incentives through formulas that are intended to have like ripple effects into people's behavior, and you can effectuate a lot of policy that way. And I said, so I think I'm kind of interested in that. So I jumped, and to Ken Rasky, who was the head of the Hospital Association, to his credit, he said, you're not a CPA, you're not a finance person. What makes you think you can do this job? So we had a conversation about it, but I wound up doing that, and I had some amazing opportunities there, just amazing. And lo and behold, in 2007, I was in Ken's office when the search firm for Healthfirst came through. And the way they do these things, the way they start these searches is that they talk to people and they get names and leads of folks to talk to and perhaps consider to be a candidate for a position. And he said, why don't you stay for the conversation? Maybe you'll know somebody. And so Heidi Leeds from Korn Ferry, an old friend now, because she does all of my searches now, she said, this is what we're looking for. Healthfirst needs a new CEO. There are some big changes happening there. And if you know of anybody, et cetera, et cetera. And so when she left, Ken said to me, do you know of anybody? I said, I don't know, I'll think about it. And I came back to him later that day and I said, I think I would be interested in this. And his jaw almost dropped and he said, so, and I should note that the plan at that time was actually a little sideways. It was, these positions are hard to get. And sometimes you can come in from the side when organizations are a little sideways because there are new opportunities, frankly. So I really didn't know what I was getting. I mean, let me put it this way. They got sideways with the regulators. Healthfirst was really kind of very challenged at that time. And the leadership change was intended to see what can we do with this plan. But I knew that with my background, I could help them get out of trouble. I had no idea what I was walking into in terms of leading the organization, but I thought, I'm just going to jump and try. What's the worst that can happen? I'll fail miserably and pick myself up and go do something else. And it's turned out to be a very different story, and I'm incredibly proud of the company. When I joined, we had $1.7 billion in revenue, because I remember that when I was getting oriented, looking at the financial statements. And as you know, we're a $16 billion company now. And
slight increase.
We've done good work. I mean, that's the most important thing. So I think that would be the answer, long-winded answer to your question.
I love it.
So,
let me shift for a little bit. Dawn has some very prescriptive questions here. But I heard you say at one point you were thinking about getting a teaching license.
Yeah.
How do you think life would have been different had you been a teacher?
I think I would have been a terrible teacher. Because one of the, I did some student teaching when I was in college. I actually was on that path, and I realized, gosh, I am really not good at this. And I thought, let me take a little break from that. And the reason that I wanted to do this was I loved my teachers growing up. I loved my teachers. So it's one of those role model things. You see somebody you admire, and then you think, I think I want to be like them. I sort of came to recognize that I prefer to do stuff than to teach, and I have impatience with teaching. So I think I would have been a bad teacher. Or at least not one of the really gifted teachers who, teachers are amazing. To me, great teachers are the most selfless people in society. They give so much to their students. And I wasn't sure that I would be able to be that selfless, honestly. So I'm not really sure where I would have wound up.
Not the head of Healthfirst.
No, I don't think I could have envisioned that one. But something involving, trying to do something for people. And I think that for me, the right level of involvement there was to try to, first start as a public interest lawyer and then, do what I'm doing now, which I think, has our company tries to really serve a mission to the community and make people's lives better. So impulse is always sort of that way. So I think I would have found something to fulfill that impulse.
You would have been the first teacher to go from teaching to the head of Healthfirst or a major health organization. I got you. Yeah. Let's shift gears for just a second. Now, your husband is a provider.
Yes, he's a retired physician, yes.
So tell me about possible conflicts that might have happened, as a head of of a major organization such as a healthcare organization
Uh-huh.
between a provider? How might that, would there be any sort of conflict there?
It's such an interesting question. So my husband actually started life as a physician, a family practice physician. His name's Mike Stocker, and I think he's on the live stream someplace.
Hi, Mike.
So I can brag about him a little bit. And, he practiced medicine for quite a long time, was colleagues with other extraordinary physicians like Dr. Mandeville, who's sitting right here. And then he himself led a large insurance company. He was the CEO of Empire Blue Cross Blue Shield. We were not married at the time. I was actually on the other side. We didn't get together until much later in life. But when we did get together, I would say things have flipped a little bit because he has now been active on the boards of different hospitals and hospital systems, and I'm on the payer side, which is just an interesting juxtaposition. So it leads to good conversations around the dinner table. We solve the world's problems every night.
Got it. So tell me a little bit about mentorships. Who served as a mentor to you, and how important is mentorship to not just AAPI, but people in general? How important is mentorship?
I think mentorship is really, really important, and it depends on how you define it, but it could be somebody that you really admire and want to emulate, and it could be somebody who had a more direct impact on your life. I would say that two people who had that impact on me, one was Whitman Knapp, who was the judge for whom I clerked, and for those old enough in the room, which would include me, but I know that many of the folks probably wouldn't remember the Knapp Commission on Police Corruption under John Lindsay. He later became a federal district court judge, and I had the great privilege to clerk for him for 2 years. And he was an amazing person. I would say, let me put it this way, that experience for me was the first time that I actually was able to sort of get an image or a glimpse of myself as a real professional. Until that point, I don't think that I envisioned myself in a particular realm or world. And Judge Knapp really sort of solidified something and made me understand, like, this is what it would mean to be in a profession and pursue that profession, with diligence and intent for a long period of time. So, and in addition to which, he was an incredibly generous, wonderful man. He would say things to me. One of the things that you do as a law clerk is that you draft first versions of an opinion. And you do research and all those things that you're good at when you first graduate from law school. I hated to disappoint him, but he was much older when I clerked for him and had incredible experience. And I would be apologetic, if the draft was not up to snuff. And he said to me once, he said, "Hold on a second." He said, "Let's get this straight. You just graduated from law school, and I have been a lawyer for 50 years. So it's possible that I will have a little bit of wisdom to be able to offer to you to help you along." And it was such a gentle, nice way of saying things. I think the other person who really had a gigantic impact on me professionally was Ken Rasky at Greater New York, because I worked there for 17 years, and he's an extraordinary, unusual individual, but the main thing I think that I got from him was being thrown into the deep end of the swimming pool over and over and over again, with the basic mandate, just succeed. You figure it out. That's not my job to figure it out. You figure it out. And so one of the first assignments that he gave me when I got to Healthfirst was to create what became Healthfirst. To Greater New York, excuse me. The state had just passed its first Medicaid managed care law, and Ken, being a very instinctive, visionary leader, said the hospitals need something like that. And I said, "Something like what?" He said, "One of those things that does Medicaid managed care." And I said, "You mean like a health insurance company?" And he's like, "You figure it out." And so, I did with, a great team and the rest, and it became Healthfirst. And it's amazing that I actually was able to go back to it after 15 years of existence. So, yeah,
That's awesome.
yeah, deep end of the swimming pool. So, it's important to let people struggle a little bit, I think, especially when you believe that they have the stuff to prevail. It's amazing. I think we can all cite experiences like that when we felt, ill-equipped, unprepared to do something, and were not given a choice to do it, and we did it. So it's true in professional life too, I think.
What type of leader are you? I mean, because I hear you talking about, folk have basically given you the opportunity to sort of direct and sort of lead and sort of create, et cetera. But what type of leader are you? I've had the opportunity of giving talks on leadership, but I'm fascinated to know what type of leader you are. What is your leadership style? Maybe that's a different question.
Yeah, I don't know, because there's probably some typology or types that somebody like yourself who studies it. I would say,
generally speaking,
I try to be genuine. I mean, I think that's really key for anybody in a leadership position. I don't think that there is any one image at all. It has to be built on who you are genuinely as a person. As a person, I am somebody who is a little bit humble, and so that's why events like this. I'm so pleased to be here, but they're not necessarily the things that I seek out, because I'm a private person. I'm a little bit humble, I would say, and so the company actually. I've gotten the response from some folks. I mean, we don't really know that much about Healthfirst, but my gosh, you're like a really gigantic, impressive company. Why have we never heard of you? And I think we have to sort of step that up, because that is perhaps a detriment. So I have to try to compensate for that, to speak loud about the company. I think without stereotyping, I think women leaders have potentially a slightly different style than men leaders. It's not good or bad, what have you. My team, we're fairly. It's not as hierarchical, perhaps, as in some organizations. It is a little bit more. I don't know what the right word is. Horizontal, maybe. Yeah, I think. I endeavor to listen very carefully to anything that anybody is saying to me or telling me in the company. I try very hard to listen to that. Try very hard to communicate as well as I can in writing and in speaking, and not all of this is necessarily easy. I also, I think that this is important for any leader. Is to build a team, because the team is everything. The team is everything. Nothing happens without, the best teams that you can possibly assemble in the world. And to get that, it starts with my executive team, is to put people in those positions who are excellent, who are different from me and are going to think about things differently, who are strong in areas where I am not strong. I don't need to clone myself on the executive team. That's a really bad thing from my perspective. To not be afraid to let other people shine. So I think that I don't know if that sums
Absolutely.
up to something.
But I want to be clear, because I did see some faces. She did not say women are better leaders than men. She said men and women are equally good leaders, or can equally be good leaders. I just want to be clear. Just want to go on record saying that. What do you think are some of the main barriers to healthcare in New York City, or health equity, I should say, in New York City?
It's a great question, and it's a pleasure to speak about that here, because I think SUNY Downstate every day tries to create more equity in healthcare. Boy, it's complicated, and so language barriers, implicit bias, overt racism in the medical system that has been embedded, that many good people are trying to get out, even when it comes to algorithms for care and things of that nature. We have social determinants of health that we have sort of discussed, which are non-medical factors, sort of upstream factors that affect people's ability to enjoy the best health they can. Whether, I think right now we have a real housing crisis in New York City and elsewhere too, but the unaffordability of housing is a major issue, because you can't have good health if you don't have a good place to live. Food insecurity, which post-pandemic is incredible barrier. So I think that all of these things, there's the social, it's great that people are much more aware of these non-medical factors and their impact on health. When it comes to the Asian American population, you have additional issues around culture, or any immigrant group really. Culture, language is really a gigantic thing. I mean, in Brooklyn in particular, the growth in the Asian American population has been tremendous over the last number of years, and it's continuing to grow. But a lot of folks are coming with unbelievable language barriers, and so the work that physicians from the community and others are doing to try to help people navigate through that. There are cultural barriers, for the AAPI community, mental health is a gigantic stigma, and so there are huge mental health issues in the Asian American community. So having practitioners and providers who are from that culture, who know how to talk to people, it's just really important. And I think that extends to every culture, really. Cultural sensitivity, the importance of physicians who are from that community, speak the language, look like their patients, understand their religious practices, and when office hours are making sense and not making sense, things of that nature are really critically important.
Awesome. So, and what is HealthFirst doing in terms of sort of bridging the gap in terms of equity in health?
Yeah. So we actually view the health equity journey through the lens of quality, because we try to be metrics driven. Otherwise, it's one of my favorite movies from Oscar season is Everything Everywhere All at Once. I don't know if you've seen it. It's wonderful, but I love the title, and so I use that actually internally sometimes when people are like, let's do this, let's do this, let's do this. It's like, we can't be. This is not that movie. We don't want to be Everything Everywhere All at Once. We have to have some structure about how we work, and especially how we measure our progress. And so we tend to view equity through the lens of quality. So, blood sugar controlled, for example, and the prevention or the reduction of the incidence of diabetes, that will lead us into, okay, if we move up, so what needs to happen at the point of care, what needs to happen more upstream, so we have supported programs in healthy food. In our Medicare Advantage program, we offer supplemental benefits that have flex cards that can be used at, green markets and for healthy food, things of that nature. The medical system is expected to cure too many ills, frankly, and the dollars in the medical system for healthcare specifically are very aimed at the delivery of actual care. The good news is that, I think, the state and the federal government are recognizing the importance of these social determinants of health, as well, in providing separate streams of funding for that. Housing, for example, food, for example. We have all of our member-facing team, whether they're on the phone or in the field with many community offices, have access to social support directories where they can automatically refer people if they need assistance. We support things like the Medical Legal Partnership at Mount Sinai, and these are pilots, again, because we want to measure results and make sure they have ROIs, where we actually through natural language processing, look through medical records to see and try to detect people who might have social issues, whether it is and need a referral to somebody to help them with housing, need referral for somebody to help them with a domestic situation, things of that nature, to move even further upstream and not wait until the point where a patient walks in and says, I need this, because they may not really, it's to anticipate, so it's working with legal assistance groups. We do things of that nature as well. And we just try to work with our partners, which include community-based organizations, et cetera, to measure our progress.
Awesome. Awesome. So HealthFirst is a leader in diversity. It's an award-winning company for diversity. Talk about the importance of diversity for not just your company, but for other companies. How important is it to have a diverse workforce?
Yeah, well, obviously it's critically important. For our company, having employees who look like our members is very important. But I think that for any organization, it goes to that thing about like, who do you want sitting around your table, helping you make decisions? You want people who have different life experiences, different backgrounds, brings their perspective, whether it's like, whether they're wearing like a sign or holding a sign up saying, this is my perspective based on my background. No, it's just where you come from really influences your view on life. People who come from different backgrounds, they see things that other people can't see. And like that sensitivity and bringing all of that together is just, it makes the team so much stronger. It's gender diversity, it's orientation diversity, it's racial, ethnic, it's linguistic. I mean, it just makes for, I can attest to this firsthand because HealthFirst is so amazingly diverse. And I learn something new every day just by interacting with people and seeing how they're viewing the same, they're seeing the same movie maybe, but they're not seeing the same story. And it's really important to get that perspective.
Yeah. Oftentimes we confuse diversity for something that's either man, woman, or simply race. When it's far more than just those two elements. So yeah, I appreciate that. And of course, Downstate is also a very
absolutely
diverse organization. We pride ourselves on our diversity. What if I wanted to be the next CEO of HealthFirst and lead the $16 billion company to $30 billion? What do I do? How do I do that?
Should I give your name to Heidi Leeds?
Not right now. I don't want the company to go under my leadership, so not right now. But what do I do? What does one do to become a leader of your stature?
Wow.
Just give me the steps. 1, 2, 3. The ordered steps. I want to write them down.
Okay, so I mean, as you heard from the way that I came into this role, everybody has a different path. The sort of more sort of structured path, I think, is increasing levels of responsibility in whatever it is that you do, taking opportunities for leadership roles, which, when things are going really well, that's not what I'm talking about. Sometimes opportunities come when things are not going well. I met somebody years ago who started at a middle kind of level in one of the large hospital systems in town here, who it was fascinating to me because over the course of his career, he became increasingly valued, and they started putting him, he started rotating as like the local executive director for the system hospitals, and starting with a small one and then eventually a large one. And the theme that I got from his story was that any time somebody said, we have a really messed up situation over here, is anybody, what are we going to do about this? He would raise his hand. He would raise his hand and go fix that issue. So I think that there's something to that about sort of like goes to the thing that we were talking about before, is like people are capable of so much more than they think they are. Like, don't be root bound by like, I got trained in this, and this is the only thing I can do, and I have to follow this specific path. It's like, look for opportunities to take risks, take responsibility, and I think there are tremendous leadership opportunities there. And everybody gets to it through a different path. So, I think, financial skills are really important. That's not my background, but really understanding the basic mechanics of how your organization makes money and survives are very, very important. Communication skills are hugely important. Emotional intelligence, I don't think any strong leader can really do that without paying attention to that EQ element. You can have gotten 800s on your SATs, but it doesn't mean that you're going to be well suited for a leadership position. So that's just hugely important too. Leaders come from, and you know this, Dr. Gwynn, from your research, they come from so many different backgrounds. There's no rule of thumb, so I think it's the combination of things. But to try to answer your question more directly, I think looking for increasing levels of responsibility in your career is sort of, will get you to a high level of responsibility.
I think you embody that. You embody that because you told us the story of how you decided, I'm simply going to jump out there. I'm interested in that. I don't think I would ever have done that. I can lead a at the time, $1.8 billion or something like that organization. I don't think I would have jumped out and just decided to do that all of a sudden. So you embody, that leadership can come from different areas. I love that.
Thank you. Thank you.
Tell me about AAPI. What is the importance of this month for AA? For the AAPI. What is the importance of it?
So it's I think it's just a great opportunity. Like many of the months that celebrate different cultures and groups, and this one celebrates Americans of Asian American Pacific Island descent. And I stress the Americans because I think that one of the issues that folks from my background or who look like me or what have you, or some variation of me, face is the persistent belief that we are foreigners. And some of us are immigrants and we have accents, and I just can't tell you how many times in my life people have asked me, where are you from? And when I say Northern New Jersey, Jersey City, born and bred, it's just tiring at a certain point. So that is I think stressing the Americans part is the important thing, because people come to this country for a reason. People make their way through this country as proud Americans, and celebrating the culture and the contributions of this community, along with all others, is just a nice thing.
Yeah. So I want to know, what do you think your legacy will be? And when you finally decide that I'm hanging up my Healthfirst hat, what do you think what do you want your legacy to be?
Oh my goodness. So I hate these kinds of questions because I hate thinking like, you're going to have a legacy or whatever. I'm proud of Healthfirst and what we have sort of created in the Downstate area and in New York City in particular. We're not perfect. We mess things up all the time. But, we persist with sort of a vision of putting our members first. Inside the company, it really means a lot to the employees who really adhere to the notion that members are our North Star. Members are, close to 1.9 million people, mostly concentrated in New York City, and sort of combining the heart of a not-for-profit with the head of sort of not publicly traded, but more financially disciplined, I think, is a balance that I'm proud that we strive for every year, because there's no mission without margin. So operating a tight ship while hewing to the mission of the organization is important. I hope that for many, many years to come, long past the time that I'm in the seat, that Healthfirst will continue to have that kind of impact.
Awesome, awesome. So we're going to take some questions from the audience. The servant leader, again, I'll define who you are. The servant leader. So we're going to see if there are questions from the audience. And I know we're also live streaming, so there may be questions there as well. Any questions?
Well, I have a question. I always have a question. Ms. Wang, can you tell us what is most important for you to tell young women as they potentially are looking to get into the world of healthcare, and particularly from the management and leadership side?
Keep going. See, I think that healthcare is an interesting profession for women. There are a lot of women in healthcare just by virtue of who provides healthcare. And so to start with, unlike, and I mean to cast no aspersions, unlike financial services or banking, for example, that women make up such a huge portion of the healthcare workforce to begin with. Mm-hmm. And so I think that women have a lot to tap into in terms of, their understanding of that community. Healthcare is a caring profession, and I'm not saying it's just women, because I was coming. Yeah, but in answer to your question, I think it's sort of embrace that. Same advice is for anybody though: is look for opportunities to take responsibility. Don't be shy about it. I think that women generally. And again, generalization, I think that women tend not to throw themselves forward as readily. They're a little bit more anxious about whether they can actually do that thing that they've never done before. And so their leadership has to be a little bit more attentive to that in understanding that you absolutely can do this, you're going to do this. Are you sure that I can do it? I'm not sure that I can do it. Yes, you can do it. So I would say, maybe women coming up should keep that in mind, that they may have a little bit more insecurity about things, or at least the way that they express it, that they shouldn't,
Yes, I have one question here.
Thank you so much for the wonderful presentation. And touch a little bit on the things that we need to do here in the Bureau to trying to fix a little bit our system of healthcare. I was curious about your ideas on the push towards a national system of health insurance that actually will likely get rid of the business as it is right now. Yeah. I just was curious about your thoughts on that.
I think we are, the American healthcare system is very complicated, right? And there's a lot of money flowing through the American healthcare system, which makes it challenging from a political perspective to think about putting it into a different form. I think that in my experience, physicians in particular would yearn for something more like a single payer system so that they can just treat the patients who walk in without worrying about whether they have insurance, whether they don't have insurance, et cetera. I think in our country that's a tough thing politically. Short of that, I will say that I think that one of the most important changes in healthcare in America that has occurred, well, first was is 65 and 66, which was the creation of Medicaid and Medicare. Mm-hmm. But then there was 2014 in the Affordable Care Act, mm-hmm. What President Obama did to change the landscape of healthcare and health insurance is like, that it was a major change because there was so much protest and fighting and Supreme Court cases and challenges and all the rest. But when you look now, 9 years later, the effect and impact it's had on healthcare in America, I think is just really huge. So, within this system, as imperfect as it is, at Healthfirst, I would say, because one of the things that we can do is get people covered. And if you don't have health insurance in America, you are behind the 8 ball, both in terms of the prospects of your family, your prospects financially, it's so essential to have health insurance coverage. And so, Medicaid expansions, which have been happening starting from Obamacare, and now states like New York are finding creative ways to try to expand insurance coverage, are really critically important. Collaboration among the unbelievably fragmented parts of the delivery system is more than a life's work, but it's something that we all need to work on. I think everybody in the room who is involved in healthcare knows how much redundancy there is and fragmentation. Competition in healthcare is not necessarily the best thing for patients. Some of it can stimulate innovation and efficiency, but some of it is just sort of like, I'm not going to share any information about my patients because I'm afraid somebody else is going to steal them, that kind of thing. That's just really unfortunate. And so I think that we have to keep working to sort of break those barriers down. The other thing, at Healthfirst, we work inside of what we would call a value-based payment model, where we sort of align our finances with our hospital sponsors, but also with community physicians to try to sort of have the same financial incentives, and where surpluses that are earned from efficient care are returned to the delivery system. And that's what our model is. There's great opportunity in that sort of framework for collaboration that utilizes modern technology to exchange information, to share care plans around a particular person. You know as well as anybody else, we treat people by their disease, and I see it in my own company. We have switched completely to try to be around, let's just take care of the person who may have 5 chronic conditions instead of putting them into 5 programs. And, you multiply it out. I mean, government is structured this way too. If you look at the state level, there are agencies for every single aspect of your life. And, I think that what we want to strive for is like combining that into person-centric view, supporting it through technology, value-based payment systems that, align the money. But the ultimate goal of, trying to consolidate more and have more of a single payer view, it might be the right thing in America. I think it's a long ways off, though, personally. I think it's a long ways off. But folks who are for that should keep going for it.
Thank you.
Thank you. I have a question from email. They catch me on email, on text, on live stream. They send me an email. The question is, considering that there's an aging population and the advent of technology, the growth of technology, how does Healthfirst and its affiliates and its provide services for those who are not necessarily equipped to manage the changing technology? What is Healthfirst planning to do, and how are they managing that?
That's such a great question. The aging population in New York State and in America is really, I'm part of the baby boom generation. This is where I'm heading. So your specific question on technology, the federal government is doing some things and needs to do more to expand really high quality broadband access. That's number one, not just home-based, but also mobile. What we find down here in the city is that there's a fair amount of broadband access that is home-based, but a lot of people are using their phones these days, and mobile access is not so good, right? Coverage is spotty. If you can't afford a really high quality mobile plan, then you're not going to have access. So that's number one. It's critically important to do that, or it's going to widen or increase the inequity problem. One of the small ways, I guess, that we try to address this, again, through our Medicare supplemental benefits, we actually offer a flex card that can be used to pay for broadband access. So even if somebody individually can't use those devices, maybe their caregiver can. But it's going to need a lot more. It's going to need education. So we have different things that are going on. We have a volunteer corps through an organization called Time Bank that can help people learn how to use devices and so forth. But I think it's a really big challenge. But wiring people up first so that there's equitable, excellent broadband access is step number one, and then I think things follow. The second thing that we're doing is that we fortunately do have health insurance designs that, especially for folks who are eligible and covered by Medicare and Medicaid long-term care, can get the full spectrum of sort of medical pharmacy benefits and care at home, all wrapped up under one care management infrastructure. Our product is called Complete Care. But it's a federal sort of category of Medicare Advantage plan, and we are huge believers in that. So we've put quite a marker down on that kind of integrated care. I think that that's going to be important for the future as well. Uh-oh.
Given the quiet, unspoken thing that the amount of money we spend in this country relative to the outcomes is fairly pitiful.
Yeah.
And the accentuation after the pandemic of something that affects everything, whether it be homelessness, gun violence, and like mental health, what do you see as the future for institutionalized health care?
Mm. Wow. I think that the needs of the community, of the healthcare needs of people are changing and can be met in different ways. There's a much greater need for things that happen in the community that don't require bricks and mortar, right? Or if it's bricks and mortar, it's a senior center or a community office. There's technology advances like behavioral telehealth, which I think are a tremendous opportunity to address some of the mental health crisis if people have broadband access and can afford it. But I think the landscape is changing. The system that we designed and built through intensive capital investments decades ago is aging and probably not configured to today's needs. I think that the goal has always been, how do we shift around the spending that is already in healthcare, because there's so much spending in healthcare, and drive more to needs that people have that don't involve them winding up in an emergency room, maybe head that off forevermore. That would be the goal. And I think that there are ways to do that, but they're not organized, and the money is sort of not in the right place. At the same time, there are safety net institutions like Downstate and many other hospitals around the state at this point that are critically important to their communities and that are struggling to meet the demands, with limited dollars that they have. So it's more money for certain, excuse me.
I would finish the question, but I don't think it's a good idea. Remain over here.
I have allergies. Oh, goodness. We have to work on sort of reshaping the delivery system to meet modern needs for people, and also understand that it's not all going to be solved by medical dollars. And so my number one would be housing, especially down here. It's just gotten, you talk about aging. People starting out in life, they're not saving any money between student debt and the cost of housing. They can't save a dime. So this is really a change from when I was starting out in life. It wasn't the financial burdens of just living day to day. Right. even employed full-time, trying to make your way through and climb the ranks and all the rest is different situations. So I think we really have to do something about that.
So a question for you in terms of mental health. Given the greater emphasis in this country on mental health, and I think this is sort of an international thing, what has Health First done in terms of sort of trying to address, as a health insurer, what is Health First doing to try and address the mental health crisis?
Yeah. So, we rely on excellent providers such as are found here. And in the community, we have very targeted care management resources. It's interesting because the use of predictive analytics now is a little bit, to me, a little scary. But everybody has been using predictive analytics to a certain extent to try to identify folks who are most at risk of the next big thing, whether it's an emergency room admission or what have you. And we're starting to introduce that too. We have a lot of members. You can't apply everything everywhere all at once to everybody. It's just, it doesn't make any sense. And so trying to target resources a little bit more is something that we're very interested in terms of really intensive care management resources. But it's tough right now. We all know what's going on. It is really tough finding people, again, preventing that homelessness in the first place by addressing housing needs, preventing the other crisis that might plunge somebody into a really bad situation that gets worse and worse. We have to work upstream. And so we're looking forward to seeing whether, there are opportunities that come through the next Medicaid waiver, which is supposed to be focused on these things to try to address that in an organized way. I hope so.
How has COVID changed operations or even insurance, payments? How has COVID changed that?
Yeah, well, like a lot of other organizations, we went completely remote for a good 2 years, and so we're starting to trickle back into the office now. I personally am not a great fan of remote working, at least running an organization. I think that the team dynamic doesn't really happen the same way when people are remote. So I'm one of those pain in the neck bosses who's like, everybody please get back to the workplace, wherever it is that you work, please get back. And we're a local plan also. It's like our members are here, don't stay home, come in and see how people are actually doing. But COVID has really, access to care in the city and the downstate area is so much worse than it used to be. People really can't find their way it was always hard in New York City, but finding available appointments for primary care as well as specialty care is so much worse now. Transportation barriers are higher. Folks can't get around on the public transportation system. They need help with cars and so forth. So I think COVID, that the public health emergency is declared over, but we all know that COVID as a disease is still here, but the impact of COVID is going to be here for a long time.
Absolutely.
I also see, frankly, the hospital systems, it's sort of, there was a huge federal subsidy, and the subsidies ended, and it's sort of okay, back to business, back to normal. It's like, no, the economy of the local healthcare system has really deteriorated. So I think that there are really a lot of sequelae to COVID for the health of the healthcare system generally. The one thing that I can't miss this opportunity for the public service announcement here. One of the things that happened during the public health emergency for Medicaid was people were automatically renewed into coverage. The general rule for Medicaid is you have to renew your coverage every year. You have to prove your eligibility for Medicaid every year. And, it's not like us. We have an HR department that, sort of just helps us renew our coverage. If you're Medicare eligible, you're in Medicare, you don't have to worry about that. But if you are taking a state program like Medicaid, Child Health Plus, Essential Plan, dual eligibles, you have to renew your Medicaid coverage. Now, starting July 1st in New York State is the first date for recertification, and over the following 12 months, we have, 1.2 million people who are going to have to renew their coverage. Statewide, it's a much bigger number. Nationally, there are 92 million people now insured by Medicaid as a result of the continuous coverage flexibility, and they're all going to have to renew their coverage. And so some people are not going to be eligible anymore, but in our experience at HealthFirst, a very large portion of the people who fail to renew their Medicaid are eligible. They don't know about it. They're busy in their lives. They don't make the deadline. But breaks in coverage are not good. It's not good to show up at the pharmacy counter and learn that you're no longer covered by Medicaid. That sets off a whole lot of things. So we're working very hard with our partners like Downstate and in the community and elsewhere to try to get the word out, try to help people with the tools of like, who's on your roster this month, who's up for renewal, and like try to help them understand what they need to do if they need help. In our case, give us a call and we'll send somebody out, or have a phone call to help them renew online, what have you. But that's a big thing that's happening right now as a result of the end of the PHE.
Well, Pat, we have taken up far more of your time than, oh, I'm sorry, one other question.
Hi, it might be sort of a big question, but could you talk about the role of primary care and value-based care in reshaping the healthcare delivery system? And also, what can the HealthFirst owner hospitals do to support primary care in that role?
Yeah, it's a great question. It should be the era of primary care. It should be, because I think, especially with value-based care, we understand that a really comprehensive primary care practice can do so much to affect the trajectory of patients. I think that there are instances of primary care sort of getting stronger, bolder. We do a lot of risk deals and value-based payment with primary care practices. I would love for hospitals to understand the importance of primary care. It is not traditionally what hospitals have invested in, but whether it is sort of as a separate enterprise or as an understanding of, especially in any kind of value-based environment, how important primary care is. I would love for hospitals to figure out how to do this well in the context of teaching programs, and reimbursement is not that low. Hospitals still, like, they're gigantic organizations, really have operated in a fee-for-service environment forever, and so that's kind of how they're built. Trying to embed more understanding of how value-based and risk arrangements can still feed the bottom line by sort of rearranging the way that care is managed, with primary care being the starting point. So I think that a lot is happening in primary care. One of the things that's happening in primary care that, personal opinion, we have to keep a very close eye on, is acquisition of primary care practices by private equity-backed firms that may not have excellence in treating the Medicaid population, for example. There are different things that are driving that, and I personally think we need to keep an eye on that trend. It's very driven by Medicare Advantage economics. I would love to see independent clinicians be able to find a way to stay independent and practice the way that they want to for their communities. Does that help? Yeah.
Well, I think we have one additional question. This is the last question we'll take.
Thank you very much for coming, and really appreciate your talk. My question is focused on the future. I'm a avid reader of futurists in terms of how do we predict the future. And so my question to you is, it's a question that comes from Joel Barker, who wrote the book in 1993, The Visions of Paradigms. And he says that organizations should continuously think about, obviously what's going to happen in the future. And so my question is, what do you think is impossible to do today in your organization or in the healthcare system? What if it could be done would fundamentally change things for the better? And whatever the answer is to that, how are you beginning to position yourself to make that a reality?
Can you repeat the first part again? I want to make sure I understood.
So it's a question about the future.
Yes. I'm sorry. When you said, what do I think is impossible for us to do today?
What's impossible to do today? Today, May 25th, 2023?
I think so, yes.
Yeah. But if it could be done, would fundamentally change things for the better, either in your organization or the healthcare system. And whatever the answer to that question is, what are you doing now to begin to make that a reality? As Joel Barker, who specializes in working with corporations in the country, says that if you want to be positioned to be nimble, to be able to reinvent yourself over and over again, you have to do a couple things. One, you have to realize that your past success means nothing, which is an obvious point. You have to look for innovation within your profession or your discipline on the fringe of your discipline, because in the center of your discipline is where the traditional established thinkers are. So only when you have that vantage point on the fringe can you look over to other areas and get that cross-fertilization that inspires your thinking. And then he says you have to ask that question often. What's impossible to do today, but if you could do it, would fundamentally change things for the better.
Sure.
And whatever that answer is what your organization should be focusing on now to make that a reality. Because if we ask that question, whatever the answer is what the future holds for us. But we can't wait for it. We've got to facilitate it going forward.
Thank you. Thank you for the question. So there's, as you all know, there's tremendous innovation happening in healthcare, whether it's on the sort of biomedical, pharmaceutical side, new treatments, devices, there's tons of stuff. From my perspective as a health insurance company, as long as health insurance continues to exist in my model, what is really not possible to do today is to really get the benefits of full collaboration among all the different elements of the delivery system in our local area. We are a regional health plan. So, our perspective is regional, local. What's happening on this block, that block, where people actually live, the languages they actually speak. All this other stuff is like tremendous, but our orientation is a little bit more that way. The fragmentation in the healthcare system is tough, right? Because there's a lot of good work that's going on, but it's not connected and people are not leveraging the strength of, the collective effort. So I would say that our theme, our goal is greater collaboration among these disparate parts. I feel like we're a little bit ahead of the game because we have a very comprehensive value-based payment model that already is sort of the seabed of aligning financial incentives. We are doing work to try to promote more connectivity and intelligent flow of information. It's really in baby situation right now because everybody has different IT system, everybody is doing things differently. But if I were to hope for one thing, at least for our small, large region down here, it would be to figure out how to connect the disparate pieces of the system that affect the healthcare of the community in a more effective and collaborative way.
On that note, we have to allow Pat to get back to her company that is gaining money or losing money as we speak. So
I don't know, what time is it?
No, we want to thank Pat Wang for coming out today. I don't want to lose sight of why we've done this. This is in recognition of AAPI Month, Heritage Month. So we want to thank her for coming for that reason, but also sharing the knowledge that she has gained over her career, as well as sharing information about herself, her organization. So we thank you. We thank you for being here. We hope that this is not a last time that you will visit us here at Downstate. We know you've been here before, so we hope that you will come back and visit with us again.
I certainly will, and thank you so much for the opportunity. It was
Thank you.
lovely to spend time
Thank
with
you.
you.
Thank you. All right, let's get back to seeing patients.